Welcome back to my channel. I'm Muriel, this as told by Muriel. Welcome to all my new subscribers. I am on a journey to 1,000 subscribers. So if you come across this video and you like what you hear or you find it informative, please go down and hit that subscribe button. I am at 506. I'm trying to hit 1,000 by the end of December. Fingers crossed. But like I said, again, welcome to all my new subscribers. I'm a registered nurse, BSN, of the last 3.5 years. Prior to, I was an LPN for 18 years, and I am primarily a long-term care nurse. I have dabbled in med-surg, but that was just not my calling. So on today's video, I'm going to talk about 3 things that I dislike about long-term care and 3 things that I love about long-term care. We're going to start with the dislikes. We're going to start on a not so positive note. We're going to end on a positive note. First thing that I dislike about long-term care, you really don't learn the skills that you would think you would learn as a nurse working in acute care. Certain skills you will not engage in long-term care, and hearing other nurses talk about, oh, we did this today, we did that, you'll kind of feel like, I'm not learning anything staying here in long-term care. And you'll want to get those skills, you'll want to do those things, and a lot of things you're just not going to do in long-term care. So not gaining all the skills is one thing that I don't like about long-term care. The second thing I don't like about long-term care is they are always short-staffed. In the last 20 years that I've been in healthcare, 21 years, long-term care has always been short-staffed. There might be 1 or 2 days during the week when all of the staff shows up, but there's normally they're short-staffed. It's like you're having to not do some of your duties because you don't have the time to do it because staffing is so low. And it becomes, especially on the CNAs, I'm not going to lie to you, I really feel bad when someone calls out, someone doesn't show up, and then instead of the CNAs having 9 patients, they end up giving them like 12 for the day. I really think that's unfair. When I was a CNA myself, I remember coming into work one day and having like 21 patients. I was young. I didn't know no better. I think I was like 18, 19 years old. And I sat there and I attempted to work a floor by myself with 21 patients. Now, of course, people came out of management and maybe did 1 bed bath, so it dropped me down to maybe like 17 patients. But still, it was too much. And that day, 23 years ago, taught me to never try to give 110% on any job, because they do not appreciate it. You would think that me doing that day, that I would have gotten the day off I requested or nothing. They don't care about any of that. They just want you to come and do the work. Because at the end of the day, you're just a body in the building to them. The third thing that I hate about long-term care, occasionally as a nurse, I have gotten stuck working into the next shift because staff is notoriously late, and it becomes to where when a certain person is relieving you that you might as well just ride it on out for extra 30 minutes. They may roll through the door 45 minutes after their shift is supposed to start, and then to add insult to injury, they'll roll through the door with breakfast, so you had time to stop and go get something to eat, and you didn't even think about the poor nurse that's sitting there waiting on you to go home, who's worked all day or all night. You could have brought me a sausage biscuit or a chicken sandwich, a cup of coffee or something, but you rolled through here, this la-di-da, 45 minutes late, an hour late, like it's nothing, and it's a continuous thing with you. I used to be petty, and I used to feel like, okay, well, if you're going to be an hour late, then if I have to relieve you, I'm going to come an hour late. I'm going to return the favor. And then it's one thing if they're late and there are consequences, but they're late by an hour, but they get to make that hour up because they just ride the clock an hour after the end of their shift. So yeah, those really are the 3 things that I hate about long-term. Now for the pros. One pro of working long-term care, your patients get continuity of care. I feel good going to work sometimes when I already know who my patients are going to be, how I have to deliver care to these patients, what works best when delivering care to this patient. The textbook way of giving care doesn't work for all patients. I'm just going to inform you of that right now. The textbook way of giving care is good for DHEC and it's good for passing whatever certification licensing course you need to pass. But the textbook way of giving care doesn't work for everyone. So you kind of have to adjust the way in which you give care depending on the patient. And I like going to work knowing that when I go in. So that first shift is going to be kind of rough when I'm just learning the patient. The second shift is going to be a little easier. By that third shift, I got it down pat. I can basically come in and I've cut off like 45 minutes to an hour of my work time because I know my patients and I know how to take care of them. I know what affects their blood sugars. I know that they run this type of way, that type of way. I know if I give them 2 units of insulin that their sugar might go from 250 to 58. So I know the things to look out for. I know how to adjust the care that I give for my patients because we have that continuity of care. Another thing that I like about long-term care is, y'all, when a patient comes in there for rehab and they're post-CVA and they can't walk, they barely can talk, they can't feed themselves, and you work with them, and over the course of like the next 30, 60 days, this patient is up walking. This patient has the use of their limbs, their upper extremities. They can feed themselves. I just be in awe of really therapy and places like that, because therapy is the one who's doing this. Just to see a patient go from not able to do anything for themselves to then up and walking and feeding themselves, I just love it. I love it. And I love the fact to know that I had an integral part in making that happen. Because even though therapy does the muscle work with them, we continue that work even when therapy is gone. Like when therapy is gone, we're there to help them still get up and go to the bathroom. We're there to help them eat dinner because their therapy is normally gone during dinner time. Like we're there to can do that continuity of care as far as getting for them progress into where they to their highest level of independence. I love that. And a third thing I love about working long-term care is, let's be honest, I know I say I hate for people to be late, but let's be honest, you can kind of tailor your schedule to how you need it to be and how you want it to be working long-term care. In the hospital, yes, they do track. Sometimes they let you do self-scheduling, and you can you do self-scheduling and you possibly get the days you want off. But really in long-term care, y'all, you can kind of schedule yourself a 4-hour shift, an 8-hour shift, or a 12-hour shift. You can plug in the holes where it needs to be, and I love it. I love that if there's something I want to do with my child that day, that I could go in and just work 4 hours. And sometimes you have to find your own relief now, don't get me wrong, but it is possible to do it. They allow, like if I want to go do a 7 to 3, and I could possibly find somebody that'll do those last 4 hours. Another thing I like about long-term care, y'all, is say something like I need to run and go check on my house. I can do that. I mean, you can honestly leave your job and go run and check on your house, make sure stuff is straight at your house, and then come back to work. Because in long-term care, it's almost like a family. We look out for each other, staff, and we look out for each other. Even though we may not all like each other, we do look out for each other. When you find that place that's like your home, even as an agency nurse, you will find places that'll be like your home because you go there so often. We tend to look out for each other, and I like that flexibility of being able to, if I need to make a quick run to my son's school, I can do that because I know they're going to look out for my patients because we work together like that. So yeah, guys, those are the things that I dislike about long-term care and 3 things that I love about long-term care. Now, every facility that I've worked, and I've worked a lot, they've all been accommodating in the positive ways, and they've all had the other things going on, the negative things, the things that I don't like going on with them. So yeah, guys, I'm Muriel. This is As Told by Muriel. Y'all know I advocate for long-term care because I love my elderly patients. I would do another one of these videos about acute care, but I can only speak from a med-surg nurse perspective because that's the type of nurse I was. But if you enjoyed this video, please hit the like button. Please go and subscribe. I'm trying to hit my 1,000 subscribers this year. I've been doing pretty good at being consistent, although I want to be a little more consistent. I've like 5 days now. I want to get it down to like every 2 days maybe. But like I said, thank you to my new subscribers, and I will catch y'all on the next video.